We reached out to BBMRI almost 10 years ago, as soon as we decided to go into the population studies, because we were seeking their guidance for the sample handling, because we were planning to collect some samples. So we collaborated with Masaryk Memorial Cancer Institute in the country, who is hosting one of the nodes of the National BBMRI, and they were helping us to develop the protocols. And then, we also consulted with them when we were designing the biobank, and then later on we became associated member. During the preparatory phase of our large teaming project, we offered BBMRI to be the partner of the project, because we really wanted to have them our long-term collaborator. And then recently we really became the full member, or starting the January 1st, I think, technically speaking, we will become the full member of BBMRI.
That's quite a journey. What's the value been to you?
The experience, one thing, and the other thing, we want to have things right. If you are setting something so expensive that is supposed to support the long-term research, you don't want to mess up at the very beginning. So we really did a lot of consultations before we made the first step.
And can I ask you, what have been the big lessons that you've taken away as you've gone through that consulting?
Everything is possible. You just have to keep trying. It's a tremendous effort. You need to have a vision. You need to find the good partners, and then just step by step.
Jens, what would you like to add?
We're just extremely proud to be a teaming partner of this fantastic success story that Jana just described, and really looking forward to a continued collaboration and moving along. Yeah. Congratulations to building up such a high excellent facility.
I would like to ask though, where do you think this partnership might go next?
I think the unique setting here of this excellent center in environmental health sciences is really the combination of different biobanking typing, from healthcare integrated over environmental biobanking to population-based biobanking. And this is a very unique setting that we need for the future to address the world's upcoming challenges, thinking about climate changes, environmental impact on health is very much on the forefront to be explored and understood. And this is what this center can really make a difference for all of us.
Where I see the future is the collaboration between ERIC research infrastructure and BBMRI, because not only we build the national research infrastructure, but in the last 5 years we coordinated the pan-European effort to build the environmental health infrastructure, because this was the element missing in the S3 roadmap of research infrastructures. They had purely environmental infrastructures looking at air or ocean or soil, or medical infrastructures really focused on clinical research, but there was nothing in between. So we tested it at the national level, and then we served as an example of good practice for development of ERIC, and we are really proud that we succeeded. And then since last fall, ERIC is a part of the S3 roadmap. And I think that now we have a lot to offer to each other, because we are bringing the population cohort, which is a desire of BBMRI to include more and more population cohorts, and we have the good partnership with the European Human Exposome project, so we can bring more partners who are active in this part of the research. We already started also collaboration in the field of development of the IT support, because during the teaming, BBMRI is supporting us in developing the software that is really running the automated biobanks. And I see more opportunities in the future, especially in collaboration with the European Consortium on Human Exposome.
Yeah, and to add on this, I think this is exactly what, as Jana described, if ERIC and BBMRI can work together, we can accelerate and multiply the knowledge gain which we really need to have. And this interdisciplinary work, everybody bringing his strengths and core competences, that will accelerate really our understanding and help one health for the human mankind.